Hello.
Hello.
It's so funny. Every time
Hi.
someone comes, I'm always at the other end. How are you?
I'm good. How are you?
I'm doing well. Oh my goodness, so many people talk to me about you.
Is that right?
Yes,
Oh, what are they saying?
that they love you.
Is that they actually?
That you're an inspiration to midwives everywhere.
Oh, that's very sweet.
From our events that people come,
Yeah?
they always say, I just love your midwife.
Oh, that's sweet.
Yeah.
So, when you're in labor, who's going to answer the door?
Not me.
Figure that out.
I only knew you were coming.
Hopefully somebody's ready at
Yes.
the gate. Awesome. We had some babies born this past week.
Oh, you
Which
stay
were nice.
busy.
Yeah. So, it's exciting. But I was thinking, like, wow, it takes a little while to get to that gate.
It does.
So, if things are moving quickly, I hope somebody's ready to
Oh,
answer
somebody
the door.
will be right at the door. The door will probably be open.
Yeah. Oh, it probably will be, because I'll drive up,
Yeah.
actually.
It probably will
with
be
all
just
my
open.
stuff. Do you want to sit here?
Yeah.
Okay. How's the baby cow?
Oh, good. She's good.
Good.
She's like a little dog still,
Yeah.
jumping around, having fun.
Good. Okay. So, how are you sleeping?
Good.
Yeah.
Better with the pillow that I got.
Mm-hmm.
We bartered with somebody for not a full body pillow, but like a little round. It's doing its job.
Yeah, is it doing, are your
Yes.
hips doing okay?
Yes,
with
a lot
sleeping?
better.
Yeah,
Mhm.
good.
A lot better.
How about leg cramps?
No, not as much anymore.
You taking that calcium?
I am.
Yeah, what do you think? Does it taste okay?
It tastes delicious.
Oh,
Actually.
good.
It's like a little ritual before I go to bed now.
Good. So do you mix it in some tea?
No, I just have it with water. Filtered
Good.
water, yeah.
Good. Yeah, it's going to really help. It's going to help with those leg cramps. And
Is that what
it's
that's
important.
helping with? Oh,
It's
because
going to
it
help
has it.
sleep, and it's going to help with your leg cramps.
Oh.
Because
Okay.
you need extra calcium when you're pregnant, and you probably aren't getting enough through your food. So a calcium supplement in this third trimester is really good.
Okay.
And the magnesium is really relaxing and helps your muscles. So it's going to help get a little bit more restful sleep, get rid of those leg cramps, help when you do go into labor to make sure that your uterine muscle is working really efficiently, right? That those muscle contractions are rhythmic and efficient. So it's important.
Okay.
Yeah.
Well, definitely it has been working. I thought it was something I was doing. I was like, good job, Amanda.
Yeah, well, it is because you're taking it. Not everybody will take it, even though we give it to them.
Right.
They don't want to take it. So, so I'm glad that you're doing that. I also brought something that I thought you might like. Here's some scripture for birth
Oh, nice.
that a lot of our moms use. And one of our moms in particular, this is what she assembled, and I thought you might like that.
Oh,
to
bless
prepare
her
you.
heart. Yes.
So really some nice stuff to pray on. Some really good scripture in there. And a lot of our moms use it right at the end and through their labor. It really helps them. So I thought you'd like
Nice,
to take a look
cute.
at that. Yeah.
Thank you.
Sure.
And tell that mom thank you.
I will. I will.
I did think of more questions,
Good.
but they're more after-birth questions.
Yeah. What do you have?
Okay, so I know you'll be involved 6 weeks afterwards, right? Up to 6
Up to
weeks.
6 weeks. So I'm going to see you several times leading up to that.
Okay. So I had questions about not necessarily parenting, but just general, like taking care of an
Yeah.
infant child.
Yeah.
I've taken classes, but maybe a refresher.
So what in particular
Like
are you
eating schedule
for the baby?
for the baby, breastfeeding to see if I'm doing it right,
Right.
to see if the baby's gaining weight, and then
We're going to do all of that. That's all
Okay,
part
that's
of your
part of it.
postpartum
Okay.
care, right?
All right.
So, and when we get a little bit further, we'll start talking about all the things, all the procedures that are available in the hospital. We offer them out of hospital, right? So
Okay.
there's things for the eyes, for blood clotting, newborn screening, different tests, and things that are available. So we'll talk about those at 36 weeks to get
Okay.
kind of like a birth plan. Do you want these things for the baby? But then once the baby's born, right, the baby you're going to be breastfeeding, I
Right.
assume, right? So once the baby's born, the baby's going to go directly skin to skin on you, so there's no separation. And then we get the baby to the breast as soon as the baby wants to, right? As soon as, within the first hour, of course, the baby is hopefully going to be breastfeeding. And then I'm going to come back and do a visit, right? We're going to spend a couple hours, make sure you and the baby are stable, make sure you have a good latch, that the baby's breastfeeding well before we leave. And then I'm going to give you written instructions for how frequently to breastfeed the baby. You're going to do a variety of things in the first 24 hours to be checking on the baby.
Are you going to laminate it?
I will laminate. You probably do need it laminated, but I will laminate that so you can stick it on the wall. Okay.
The Angel Vets laminated the new calf one.
Okay.
So
All right.
I got to do it one step higher.
Okay. So we're going to do that. But you know, you're going to breastfeed the baby every 2 hours during the day and every 3 hours at night.
Okay.
Around the clock. That's what you're going to do.
2 hours and 3 hours.
2 hours and 3 hours.
How long was it? 2 hours, 3 hours the first week?
Until the baby regains its birth weight, right? We want you waking the baby up, right? Making sure that the baby's thriving. We want to make sure in those first few weeks that your milk supply is coming in. Babies won't wake up on their own initially. They will get very dehydrated. And the more dehydrated a baby gets, the more tired the baby gets and becomes lethargic. So it's harder to wake up. So that's why you want to wake that baby up every 2 hours. You know, wake the baby up. Give the baby an opportunity to go to the breast. And everything I'm talking about now is written down, and I'm going to go over it again before I leave. But we have to start really thinking about, okay, how am I going to do this in this environment? And how are your housemates going to tolerate a crying baby? Right? Night 2 and or night 3 of the baby's life, there's lots of crying. Usually from usually from like 10 p.m. to 4 a.m. There's like a lot of just squawking, a lot of crying. So it might make some people really concerned, really agitated, especially, I mean, I don't know what the environment is like, how snappy people are.
Sometimes they can get a little snappy.
Sometimes it can get snappy. So that might be a conversation when we get closer. Before the baby's born, maybe we have a meeting and talk about some of the things that might go on with the baby. But for you to just think about, okay, there's not a whole lot of sleep. You're going to need a lot of, you have to recover. Right? It's a big event going on in your body, big hormonal shift. Blood volume is changing. There's bleeding. There's recovery that has to happen. So you're going to have a bit of downtime.
So how long is recovery typically?
6 weeks is your postpartum recovery time. Not that you have to be
like in the bed.
You're not, bedridden. But for the first 2 days, we really want you laying low, right? There's quite a bit of swelling, so we want you laying down, and we want people taking care of you for those first few days. Hi.
Hi, Nikki. Sorry, I didn't make it up there.
That's okay. I just saw it and I was like, oh, let me go.
Oh, great. We're just talking about after the baby, like the immediate postpartum, after the baby's born, how important it's going to be to be taken care of for the first few days. You know, we don't really, and everything I'm talking about with her now, I'm going to have written down. It's our postpartum instructions that we always leave with all of our moms. We have postpartum instructions written down for mom and baby.
Okay, great.
And then we're going to read those instructions to anyone who's going to be helping.
Okay.
So we're clear when we leave that everybody understands what's going on.
Okay.
And then I'm going to be back to visit 24 to 48 hours, depending on who's having babies, right? But 24 to 48, we're going to come back and do a visit. And then again at 1 week, 3 weeks, and 6 weeks, or as often as you need to be seen to make sure that the baby is thriving, right? Because we're checking on the baby as well.
Okay.
But for the first few days, we really don't want you doing anything.
Right.
Right? We want you laying down. We want you to recover and get that swelling to go away, and your bleeding will minimize. And then after like the second day or so, you know, you can be up and about and moving, but we don't want you resuming chores. Okay, so our normal home birth mamas, we have them, you know, chill for 2 days. After that, they can get up and go and enjoy meals with their family, sit in the living room, but you're not cooking, you're not cleaning, you're not vacuuming, you're not raking, you're not doing anything strenuous.
Okay.
For about a week.
No, it's not.
No, I think
I'm very much like, stop, Amanda.
Yeah, I think everyone is so concerned about your well-being. It seems when I'm here that everybody's quite nervous about your well-being, which is great. So they're going to be particularly, I think, you know, particularly concerned about making sure that you're okay. So I think it's going to be all right. It's going to be you. It's generally the mother That's the harder one to keep down.
That's what I'm saying.
It's
Like
not
right
the
now.
other people
Right.
wanting you to do stuff. It's you agreeing. But I can tell you that the more you rest in the very beginning, the faster you will heal. And that's up to you. We have a mom right now that, you know, I just saw her yesterday, and her husband is like, you know, she won't stop. The baby's 10 days old. She won't stop. She won't rest during the day. She's cleaning, she's vacuuming. And we talked about it. And I said, well, you know, she's not going to stop. That's not in this mother's personality. It's not what she's going to do. We can sit here all day long and agree
Right.
that you shouldn't be doing those things. But there is a point where you need to figure out what you can do for yourself. And this mom, it's more stressful for her to rest than it is for her to vacuum the floor, even though she shouldn't be doing it. If she doesn't do the vacuuming, if she doesn't do the cleaning, if she doesn't do those things, she's definitely not resting because she's too worked up about it. Right? So we have to find that balance between making sure that you're not hurting yourself, but the other people around her recognizing that she's a grown-up and she's going to do what she needs to do that's going to help her emotional well-being. So for this mother to vacuum is more important for her emotional well-being because she's not going to rest.
So what about doing dishes?
Well, why is it that you want to work immediately postpartum?
I can't. I've never sat down for 10 days and not did anything.
Well, you won't sit down for 10
You'll have
days.
the
You're not going to be
baby.
sitting for 10
Oh,
days.
yeah.
Right. Of course. So
You'll be
right now,
breastfeeding like multiple times a day.
you're going to
Right.
be feeding
Yeah.
10 to 12 times in a 24-hour
Exactly.
period. So it's not that you're not doing anything. You're physically nursing a baby. So, yeah, you want to try to do the dishes while you're nursing the baby?
No.
It's not going to happen. You're
Okay.
not going to physically be able to do
diapers,
it.
Like you'll be very busy,
Yeah.
but not with chores.
Okay.
Right.
You'll be very busy.
But washing dishes, interesting, in the third trimester, washing dishes is tricky as you get towards the end of pregnancy. Are you washing dishes? I mean, you probably are, because does everybody like do their own dishes, or does somebody
I
like...
do my own and the other dishes.
And you do the other dishes. So the thing about washing the dishes is that position that you're sitting at the sink, because your belly is in the way, so you have to pivot, and it actually can cause a lot of stress on your back. Is your back hurting?
No. Well, I guess it was a blessing and a curse at the same time. The guy who built the sink, he's 6'4", 6 something. He built it higher than what it's supposed to be.
Oh.
And so my belly fits right underneath it.
Oh, really? So you're not having to do this. So that's the thing about the sink, because you're standing and you're in this pivot position for a long time. So we have a mom that's a caterer, and she just like cooked all this food for like 200 people at 30. Actually, she's due right when you're due, like, you know, so she's 32, 30. I think she's like 30. Actually, she's like 36 weeks. Back just thrashed her back because she was pivoting. That pivot position,
Not every
there's a
night.
lot of pressure. So that's something to just be aware of and and just understand, yeah, you know, you can do the dishes. It's not that you can't, but recognize like, oh, that might really start to aggravate your back. So if you want to, I don't know if your belly fits under that sink. That's crazy.
He built it
It's
quite
tall.
tall.
Yeah,
Same
okay.
with same with the sink in the bathroom.
It's tall.
Yeah, and the table
Okay.
was that way too, and he had to cut
The
it down.
table is tall
It's
He
now
had to cut it down.
because it was too tall for
It
some
was
people.
too tall for
Yeah.
everyone except
Yeah,
him.
yeah. Oh, that's funny.
Yeah.
So things like that, you know, you should still be doing your moving around and doing your chores. But after the baby, you know, you're just one.
I'll calm down. If it's
Well,
if
you're
it's-
gonna. You're not gonna have a choice
right.
to calm. You're going to calm down because just physically, you're not going to be able to do it.
And then he said 2 hours and 3 hours of sleep at a time.
If you get that much at a time.
Because
So-
you have to be feeding down the next
Right?
day.
So you want to feed the baby every 2 hours during the day. So it may take you an hour to get one feeding in initially in the first 2 weeks. The first 2 weeks are really rough. It may take you an hour to get a nutritive feeding in. Right?
How would
and
you
then
know?
I'll show you. Once the baby's here, you know by the type of suck the baby's doing. There are two types of sucking that a baby does. They do nutritive sucking and then they do pacifying. So nutritive sucking is big pulling, and you can see it pull all the way to the baby's ear. And they generally go suck, 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 swallow, rest, fall asleep. And then they go to this little flutter sucking, right? And they'll flutter suck, which instigates a hormonal response, right? It's one way to increase the milk supply. Flutter suck, flutter suck. Oh, right, I'm supposed to be drinking milk. And then they'll deeply suck again, fall asleep. Newborns sleep, they'll suck and they'll nurse for maybe 2 to 3 minutes, and then they'll fall asleep. It's not an adequate feeding. So then you're going to wake that baby up, switch sides, stimulate, get the baby to the other side, right? Do it again. 3 minutes, falls asleep. So now we're, by the time you get 15 minutes in of nutritive sucking, a lot of times in the beginning, depends on the baby's temperament, but some of, in the first 2 weeks, it's going to take a while. So then that's an hour. Then you're going to go 2 hours from that, from the end of that feeding, right? But after the baby feeds, now you're burping the baby, you're calming the baby, you're changing the baby. So it's not nursing the baby and then everybody's asleep.
It's a full-time job.
It is a full-time job.
It's no joke. Right? It's hard. It's hard. And then, obviously we do it, and we do it more than one time. Right? So if it was impossible, we wouldn't exist as a species.
Right.
So we do it and just start thinking about, just recognizing this is a huge life change, and it goes from 1 to 2.
Did you tell her about yesterday? She was talking about the position of the baby, and she's like, the baby went.
And I was like, ah! It was scary.
I know. She's like, I don't want to touch it. I'm like, are you ready to be a baby? She's like,
It was weird. Jeez.
What did you feel?
Like its whole body want to come out.
Oh,
Not
so
down that way,
had.
from this way.
So you had a Braxton Hicks contraction.
No, it was like a full
right.
And then
pushed out and stayed there, and then it went away, and then the baby came back down as if the baby was pushing all
out,
the way out, and it lasted for a couple of seconds, maybe a minute,
and then it happened right after again. Like, it was just weird.
Right.
Oh my
was
god.
it your whole belly, or was it just the head or something?
It was like one spot,
right,
where it was just
pushed out,
like where I was like, oh,
Hicks.
get it.
Yeah. So what you probably had was a Braxton Hicks contraction. Moms describe it as, it's not a menstrual cramp. It's not labor contractions. It's not cervical changing. Moms describe it as the baby just kind of balls up and pushes out. Oh, and it pushes and it kind of takes your breath away. You have to take a deep breath, and it's like really tight and pushing out.
Yeah.
Did you lose
and
your
then it
breath
goes away.
during it?
I think I was so it's like weird.
So it doesn't you don't lose your breath, but you want to go because it's just tight. It's tight, and then it goes away.
Like a knot, but it was just
okay.
It was something I didn't know. I was like, wrong way. You're going the wrong way.
Yeah, so that sounds like a Braxton Hicks contraction, and those are going to start happening more and more as we get closer. Right? It's the uterine exercising, and it's getting ready, and it's that muscle has to tone in order for it to have really efficient contractions, right? Because the contractions, that uterine muscle works, and it's pulling that cervix open. So if that muscle has never worked before, it's not as efficient. So you start having those Braxton Hicks that start toning that muscle and getting it ready, building that muscle integrity, so that when it's showtime, you go into labor and those contractions are really efficient. I have somebody in labor, so I want to check my phone.
No problem. I got bit last night.
So,
Itchy or no?
Yeah. Mosquito. They.
So after the baby, you're going to be busy, and you burn a lot of calories when you're breastfeeding. So you're going to be really hungry and really thirsty. So the thing that your family members here are going to be doing for you is making sure that she's got water and some just snacks, right? Because every time she goes to feed the baby, she's going to be really thirsty and hungry. So little feeding stations set up.
Cook for you.
And
It's
then
gonna be organic.
good, it should be. And leading up to that, right? Leading up to those last few weeks, right now you're 32 and 2, right? That's what we have you at, 32 weeks and 2 days. So you're still feeling pretty good. You're still in a really good place in this pregnancy. Once you hit that 37, 38 week mark, you're gonna be tired.
Would I be a lot bigger?
Yeah, you can be a lot
think
bigger.
so?
You're right from pubic bone to fundus, the top of the uterus. It equals how many weeks pregnant you are. So we're expecting you to go to 41 and a half
So
weeks.
41 and
Yeah. Yeah, you're going to get significantly bigger. The baby right now is putting on body fat. So the baby's fully grown, can live outside of your body, but has no subcutaneous fat, right? It's starting to put in that layer of fat under the skin right now. So watching what you eat is really important, because the baby's putting on about a half a pound to a pound per week. So we want to, I think that your dietary habits are pretty good. I mean, you're pretty limited to what you can be eating, so it's not like you're out snacking on frozen yogurt.
No, especially hanging around her. It's
No, she's not.
Do you guys, you also purchase food?
Yes.
Yeah, so I just put in an order for mostly, like the lunchtime meal is usually the most nutritious because that's the one that I'll make with her.
Oh, good. Good.
But she's been checking in, which is great. Like, how's this? Is this better? And like even this morning, I was like, more fruit, because that's been limited.
The fruit. The fruit is okay to be limited, right? We want to keep the fruit to too much sugar. We want to keep the fruit to 2 servings a day.
Yeah, she's been having like a half a serving though a day.
Oh, okay.
So like under what she needs.
Yeah.
So, but it's okay. We're
blueberries, blackberries, raspberries, all those berries, super high in antioxidants, really good. You can eat them all day long if you have them.
Yeah.
But things like strawberries, bananas, the higher fructose, the higher on the glycemic index, you want to limit. Dates are really good. Dates are really low on the glycemic index. Prunes, really high in iron.
Yeah,
like
it's
them?
like, none of these things are like limited.
Isn't that what my grandma eats?
Yeah. Some people like them, and they're really high in iron.
Good. They're good.
Raisins, high in the glycemic index, but high in iron. But her values were all good.
Okay,
her D levels were low, which everybody's D levels were low, so it didn't surprise me. But your iron levels were all good. You were in good shape. Yeah.
Okay. From people I know back home, 90% of the people I know who has already given birth, I'm doing much better than they are. And I'm in this environment.
What are they complaining about? What were their...
It was like I don't have swollen feet.
Right.
I don't, I'm not nauseous, sick. I don't have to rush to the hospital all the time. There's no fluid drain, everything. No fibroids or, diabetes. 90% of the people I know back home. Right. But they all went to the hospital. Oh my gosh, you guys.
Actually, you have no fibroids, which, in African American women, it's common. So, but you don't. I finally got your lab results from your previous doctor. And let me just double check. Yeah, everything looked really good. Baby was measuring perfect. There were no fibroids. They did some genetic testing on you. So, and your sugars in the first trimester were really good too.
Yeah,
so,
that was before you, Nikki. See?
That's right. She was in good shape.
I was trying.
And the thing about
salad, you said too, right?
Yes.
What did you say?
I was eating quinoa in my salad before I got here. I just didn't know what it was. I was just eating it.
Really?
Yes.
Awesome. That's good.
And she figured out this, and she's like, "Oh, I've eaten this before."
I've been eating this. Oh, good. Yeah.
So it's funny.
So a lot of that swelling in pregnancy is common, but it's not normal necessarily. You shouldn't be swollen.
Okay.
A lot of swelling comes from processed foods, right? High sodium.
Oh, that's what it is.
Or not drinking enough water. Right? Dehydration will cause edema, and really it comes from. Not always. We have some moms that have some swelling. That's not due to diet, but generally speaking, you shouldn't be swollen.
Like with the sun and everything, I was thinking maybe because the sun.
I think you're hydrating well.
Yeah,
right?
Yeah, she's always walking around with her thing of water. She's really good
well.
with that.
And you don't have that much opportunity to be eating highly processed foods, right?
I can.
Yeah,
I choose not
yeah,
to.
she hasn't
You
been
can.
ordering that.
I can't. I
Are
can
people ordering them?
Yes,
Yes.
like donuts and
top
cookies
ramen and Vienna sausages and cans.
I
Spam.
know.
Why? Well, because that's what they want.
That's what they prefer to
Everybody
eat.
has their own palate.
Why?
But you're not to eat those things.
No filtered water either.
No.
Yeah. No. Everything.
Yeah. Okay. Good. Yeah. Don't eat that top ramen.
No, she had some and she
I had
borrowed
one.
them off.
No.
And
Yeah. I tried. It was like way back when.
Oh my goodness, I didn't know about it.
Right. And not that you can't have salt. You can, sea salt. Do you have sea salt?
Yes,
Okay,
I've
so
made
sea
it a
salt.
point for
Salting
us
your
to
food to
sea salt.
taste is good, right? And sometimes we have moms put a little bit of pink salt in their water if they're drinking a lot of filtered water.
For the minute. Well, we have reverse osmosis.
Yeah, so the sodium, there's not 10, if it depends on how much water you're drinking, you're not absorbing all of that water. So we have put a little bit of pink salt in there to help the sodium content, because you need sodium, right? And so it helps you absorb that water, makes it a little bit more balanced. But you're not showing any signs of dehydration, so it sounds like you're doing just fine.
And she's salting her food.
Yeah, good.
With sea salt.
So as you get towards the end, and we're going to continue to talk about it, but just know, like, okay, you are going to slow down towards the end, because it's really hard to be walking around with a full-grown baby inside your body, and your blood volume is doubled. You're carrying some weight around, and it's hard.
Maybe
and hormonally,
I'll pick up poetry or something.
Maybe
Start writing.
I don't know. I bet someone probably is good at that.
There's so much going on too with the baby. Trust me.
No, like when I get big.
Towards the end, those
yeah.
last few weeks, just to be patient with yourself and recognize, like, okay, this is part of it, and I'm gonna be seeing you weekly at that point, and we're just gonna keep talking. So my biggest concern is that you're, still moving around, but starting to recognize that things will change. You don't know what they are. There's no way for you to really prepare, because you don't know it until you do it.
Right.
You have no idea what being a mother is going to be like until you're actually a mother. I can sit here all day long and prepare you and tell you what contractions feel like and tell you how it is to nurse a baby, but you don't know it until you do it.
It happens, right.
It's in the doing of the behavior. It's in the doing of it that you know it, right? So we'll just keep talking about it. And you're going to read some scripture and pray on that. That'll be good.
So I'm 32 weeks.
You're 32 weeks and 2 days.
32 weeks and 2 days. Okay.
Yeah. And so there's no test until 36 weeks. We'll do a culture on you at 36 weeks for Group B strep.
Okay.
And we'll see. Hopefully you'll be negative. Otherwise,
Like strep throat strep?
It's a different type of strep. It's Group Beta strep. And so it lives in our bodies. It lives in the lower segment of our colon and in our noses. And some women are colonized in the vagina. So we're going to do a vaginal swab to see if it lives there.
That's to prevent eye infections in the newborn, right?
No, that's chlamydia or gonorrhea.
Oh, okay.
Group B streptococcus is it's a naturally occurring bacteria. But if we have it in the vagina, the concern is that the baby will contract it. The concern is not if you have it, because it comes and goes in the body. The concern is, since the baby has no immune system, when the baby comes through the birth canal, the baby can contract Group B streptococcus and become septic. So because the baby has no immune system, the baby can become infected, and that bacteria can overgrow rapidly in the baby's body.
And what happens if that?
It could make the baby very, very sick, and worst case scenario, very low likelihood, but it could cause fetal death.
Okay.
Right? So septicemia. Right, Group B strep septicemia. Septic is when it goes through the body, right? And so it could make the baby very sick. So we want to culture moms. That's the standard of care in the United States, that we swab all moms to see if you have that bacteria. If you do have the bacteria, you can still have a vaginal delivery, but we give you antibiotics in labor.
Okay.
So we'll give
and
you...
it's common for women to, or
25% of women will be positive for Group B strep. So it's not alarming.
Where you get it from?
It's naturally occurring bacteria in the body.
Okay.
So, and since it lives in the lower segment of the colon, for women, it will migrate across the perineum into the vagina. And we'll have it sometimes in the vagina.
Actually, speaking of that, Amanda wasn't aware that when you're pushing, like, you can be going to the bathroom during birth and all that kind of stuff.
Yeah.
As a possibility, it's not definite. And so...
Yeah, we all poop.
Yeah, and so it's... And she was like, well, how do you prevent that? And so, like, I guess... Yeah. And then I told her the other option is, like, to give enemas before.
Right. Well, what happens generally in early labor, your body is very smart. It's perfectly designed, right? So that's what happens, is the body generally evacuates in early labor. You start to have lots of loose bowel movements in early labor, so your bowels evacuate. Because the thing about it is there's not a lot of room in the pelvis, right? So there's not a lot of room between the vagina and the colon. So when the baby is descending into the pelvis, it compresses the lower segment, and it just starts, your body starts to evacuate. And hormonally, your stools get really loose, and you generally have a ton of bowel movements before the baby's born. And so when you're pushing, you're not having giant bowel movements while the baby's coming out. They're like little rabbit pellets. No, nobody will even know.
It's a natural process.
And nobody really knows, except the midwife who's catching the baby, because it's very small. right? It's not large amounts of stooling that's going on. Really small. We keep you clean. We have those blue pads. We have these blue pads underneath your bottom. So we're just going to wrap them up and throw them away and put clean ones underneath you. It's a little bit different than the hospital where, well, it's not that different from the hospital, but we're pretty obsessive about keeping your bottom clean and making sure you feel comfortable.
Great.
And so you're not going to even know.
Yeah.
Okay.
Generally, you won't know. But if you are, like you were saying about an enema, if you're feeling really inhibited by that, you could do what's called a fleet enema, which is a really small, lower type of enema. They buy them and get them in a little box, or they're easy to
It's
come
just
by.
exit only. It's okay.
Yeah, you'll be fine. And generally, the body takes care of it and does all that evacuation before you're really actively laboring.
Okay.
But that's part of it.
Yeah, because she doesn't know any of this stuff. So I'm like,
Nobody told me.
Yeah, well,
That's
my
it.
grandmother
Yeah.
didn't know until she was giving birth to her first child where they even came from. And
Wow.
this is back in, I don't know what year my uncle was born, but basically she didn't even know what part
Yeah.
of her it was going to come
Well,
out
the baby's
of.
coming out of your vagina. It's going to feel like it's coming out of your butt, but it's going to come out of your vagina.
I'll be squatting, not laying down, right?
Not necessarily. I don't know.
Whatever I'm
You're going to be
comfortable
whatever you're
with.
comfortable with. You know, so I did a birth yesterday. I actually missed it by like a minute. But it was her fourth baby, and I came in. Baby was born, and she was semi-reclined on the bed. And I asked her, I said, okay, is that the position you delivered in? And she said, yeah, this is her fourth baby, fourth home birth. I said, oh, did you got into that position to have the baby? And she was in a regular semi-reclined position. And she said, yeah, you know, I was squatting and then I was leaning forward. Leaning forward is a really typical laboring position because it takes the pressure off your sacrum when you're in that forward leaning position. So many women go real forward and kind of rock their hips, and they'll deliver on their hands and knees in a forward position. But she said she did that, and she wasn't comfortable. She wanted to lay down. She just felt like that was a better position. So she did. She lay down, and that's where she intuitively, that's where she went. So being on your back is not the end of the world. You hear a lot of stories like, oh, don't be in the bed, don't be on your back. Squatting is natural. Squatting is the best position. Squatting is a good position, but it may not be for you, right? Everybody will find their own position. I was teaching a class last night talking about trusting your body. You will know intuitively what the best position for you is. And if that's flat on your back with your legs straight back, that might be the position you want to be in. So there's no judgment on which position, and you don't really want to get locked in to, I have to deliver in a squat. Squatting actually can cause some damage to the perineum. So we tend to try to tilt you, once that head is coming over the perineum. You know what the perineum is?
No.
Okay. So you have the vagina. You have this band of muscle, and then you have your anus, right? It's very similar to this right here. It's this band
the
of
thing
muscle.
you cut.
Yeah,
in
we
case
don't
you
cut.
need-
But
Yeah.
yeah, you would cut it
not. Please don't. But
right. If necessary, sometimes that's
if
an
necessary,
episiotomy.
some doctors cut.
Yeah,
that part.
that's called an episiotomy, where they'll cut that tissue right there. So that's the part of the body when you're delivering the baby. That's the part that's stretching, because we don't stretch towards the top. That's your pubic bone. There's no muscle up here that's stretching. So you stretch down, very similar, and it feels kind of like that. And that band, when I stretch my fingers out, it's similar when for a first-time mom to get that baby over that ridge right there. So sometimes, you know, when you're in a squat, we can't do a whole lot to protect the perineum.
Right.
So we try, but there's a lot of pressure on the perineum when you're in a full squat. So we tend to squat, get that head right down onto the perineum, and then tilt you back a little bit to release the pressure on that perineum to guide the baby over it, so it can, hopefully there'll be less damage. But that's that perineum, that's what that's called. And why your diet is so important and your hydration is so important is what you eat creates your tissues, right? It helps your cells and it helps the tissue integrity. And so when we have moms that are eating good, healthy food, real food, dark green leafies, and all other types of vegetables, high in vitamin B and high in vitamin C, right? It knits that tissue very strongly, so it's less likely to tear. Smokers have more, it's called friable, where their tissue just kind of breaks away, because nutritionally they're pretty, it's insufficient, right? Because smoking depletes the body. And so it's not good oxygen perfusion down there, and they're smokers, and it just, will fry and
Oh.
break and tear. But if you have a really good, healthy diet, it won't mean that you won't tear, but it gives the tissue a whole lot more stability and less likely to be friable and to tear away. And hydration is really important, and good fats are important. Avocado, coconut, olive oil, nuts and seeds.
Speaking her language.
Right?
These are all the things I literally
Right. So really important. Those
Sure,
omegas are
yeah.
really important. Those fatty acids are really, those essential fatty acids are important. B's and C's are really important to help build that tissue integrity, to help that perineum not have too much damage.
Okay.
Okay? And then the pushing position is helpful. And we do a lot to protect the integrity. So your baby's moving. Right?
Yes.
Lots of
A
movement.
lot.
Any vaginal bleeding?
No.
You pooping every day?
Yes.
Good. Any headaches?
No.
Do you have questions?
Well, mainly just so Amanda can hear this. So how, should Amanda be walking around, or should she be, you know, like every night, should she maybe walk around the property, or, you know?
Wait, my
Did
back.
she just throw you under
My
the
back.
bus?
Ow.
Oh,
I can't
yes.
walk.
I tell all my moms, they should be walking an hour a day. But so most of them don't live in this kind of environment. Most of them are in their homes, on their couches, driving, working in an office or something. So we really encourage them to get out and walk an hour a day. So I don't know how physical you are here. So yes. Once it's
Even
cool.
a half hour then.
I can do a half an hour.
The point of the hour is getting real good mobility in that pelvis and helping that baby align into an optimal position. Did we talk about that last time? How we
Yes.
want that baby to come in,
And then go down.
right?
Yeah.
So we want that baby to come in, head down, chin to chest, and baby's back to your belly. And so when you're walking around a lot, so the heaviest part of the baby is the head, right? So gravity is going to bring that head down. The next heaviest part of the baby is the back of the baby. So when you're walking and you're in an upright position, it rolls that baby into an anterior position, right, to your front. When you're, which I don't think you're doing much of because you don't have like reclining chairs here. So it's not like you're kicked back with your feet up
No.
on a cozy chair, which encourages that baby to be in a posterior position, which makes labor much more difficult. But walking that hour really, it gets just good circulation, and it helps align that baby and gets that pelvis moving well.
Okay.
And what about her breathing and stretching and that kind of stuff?
Are you doing yoga? You don't want to do that.
No. I'll pass out. No, I tried yoga, but it was with others. And so I just did a little bit because.
You're a yoga instructor? Do you do prenatal?
I'm not as much, but I do know like you're not supposed to do twisting with the
You can
baby.
modify what you
Yeah,
do.
exactly.
So you
can
know, she could do
modify
down
it.
dog, but you don't want to do it too
Right.
severe of a down dog.
Exactly.
All those things that are going to have you bend over and kink that, compress the vena cava. So that major blood supply that's bringing oxygen to you and your baby, you don't want to be bent over a lot of the time. But she can do, all kinds of stretching.
All the hip openers she can do.
All the hip openers she can
Yeah.
do. You're not doing any core stuff, but you're doing all those
Exactly.
hip openers and balance stuff, strengthening. And if it feels good, it's good. If it doesn't feel good, don't do it. Listen to your body. You'll know it won't feel good. Not that you don't like it, right?
Right.
You may not want to get up and do yoga in the morning, but that's not the determining factor. If you do something, you go, ooh, that makes me feel weird. Don't do that. Okay. Breathing, right? The thing about breathing is you just want to do deep yoga breathing. That's all we do in labor. Just simple.
That's
Well,
like, remember the
let's
day
see.
you got nauseous and I was like, breathe through it.
Breathe.
And she breathed through and she didn't vomit. And so that was like the one day we did breathing because she felt nauseous. I think she laid down after she ate. But
Were you on your back?
Yeah.
Yeah, laying on
She
your
was
back.
on the hammock.
Laying on your back may make you nauseous because there's too much pressure.
Oh, it
On
did.
your-
I had to stand
Yeah,
up.
you can't
And
do it.
it was hot
Which
that
was
day.
something-
It was really hot.
But she was able to breathe through it when instructed. But it's true, if you do the stretching and the
Roll
breathing
to your
and
side, right? If you're laying on your back and you're feeling nauseous, you have to get off your side. Ouch.
Something just bit you.
Some just bit me.
Oh, you've been initiated.
I don't like that at all.
I've had a lot of bites lately.
So roll to your side, get off your back, right? If you're on your back and you feel nauseous, you feel lightheaded, clammy, you need to listen to your body. It's saying change your position, right? Not good. But through labor, so did anybody tell that cow how to breathe?
No.
She just did her normal breathing, and you're just going to do some deep breathing through labor. That's all we do, is in through your nose and out through your mouth. And at the end of pregnancy, sometimes it's really hard to breathe through your nose because everything is congested. Not that you have a cold, but all the mucous membranes are really full, and it's hard to take breaths through your nose. But in general, you're just deep, slow, deep breathing is all that you need to take you through labor.
So you can really combine the stretching and the breathing at the same time, so it's not like this whole big thing. So if you want to do that today during
You
lunch
could start
after.
practicing just some basic stretching, slow, deep breathing.
I just wanted her to hear it from you.
Yeah. And we're going to be here while you're in active labor, and we're going to help you through all that breathing, right? We're going to remind you, because labor is so consuming, you forget to breathe. You do. You just hold your breath. I don't like that. And then the pain increases exponentially. So we're going to say, drop your shoulders, relax your hips, let your feet go loose, breathe in through your nose, and out through your mouth.
And that's like the same thing I'll be telling you during the stretches.
Yeah, same thing.
Yeah.
And so in terms of her yoga moves, you're just going to modify it where it's just, she's not on her back.
Yeah.
All right.
Okay. You need to prepare for a marathon.
Yeah.
If you were going to run a marathon, you wouldn't just get up today and go run that marathon.
No.
Labor is a marathon. It is a long haul. It's your first baby. It is no joke, and it is long. You're looking at, 24 hours.
It's the biggest exercise you'll ever do.
I know. Maybe I'll tap out.
Yeah,
Here,
there'll
you
be no
finish,
tapping out.
you finish
Sorry.
for me.